of the France healthcare system by Jordan Stout, Aaron Costigan, and Alex Banks. France is located in Western Europe, bordering Spain, Italy, Germany, Luxembourg, and Belgium. France has a total population of 66.2 million people. France's capital, Paris, has a population of 2.2 million people itself. The main language spoken is French. France is home to many exciting places and landmarks, gorgeous beaches, historic cities and villages, as well as ancient ruins and majestic castles to visit. France has a parliamentary system government, which makes it easy to implement change, whether change is regarding law, health, or any other area of need. One reason why France's healthcare system is #1 in the world is because they're constantly changing and implementing new policies and technologies where needed. Not to mention their high life expectancy, modernization, overall health of the population, and positive feedback of the citizens. According to many world-renowned health organizations, France is considered to be the leading healthcare system in the world. France has a very low infant mortality rate at 2.2 deaths per 1,000 births. They have a low GDP expenditure of health at 11%, and French physicians are required to serve and provide healthcare to every resident in France, regardless of age, income, or status. Healthcare comes at a very low cost. Sometimes it is even free, due to the role of Social Security in healthcare. Last but not least, healthcare in France is highly accessible to everyone, whether in urban or rural areas, wealthy or poor. France's population overall has terrific health. The average life expectancy is 82.5 years. The top 10 causes of death in France include heart disease, Alzheimer's, stroke, lung cancer, colon cancer, breast cancer, influenza and pneumonia, other injuries, diabetes, and pancreatic cancer. They have a very low HIV-infected population and only 2 deaths per every 100,000 cases reported. According to the World Health Organization, the entire population receives very good drinking water and sanitation means. Now on to education and training for physicians in France. Among the many differences between the U.S. and the French healthcare systems is the approach to medical training. While U.S. medical school graduates in 2008 had an average debt of $154,000, French medical students receive their training virtually for free. For example, first-year medical students at the Faculty of Medicine in Paris have only one mandatory course for this year, an enrollment fee of $264. The amount of debt facing a new physician has many effects on the healthcare system. According to the Association of American Medical Colleges, heavily indebted doctors are less likely to choose primary care fields and may work more hours, leading to fatigue and possible medical errors. Here's a closer look at how doctors are trained in France. Medical education is made up of 3 cycles that are provided by 34 universities. The first cycle is 2 years. It consists of general scientific training not delivered in hospitals. There is a competitive exam at the end of the first year. It is highly selective and charts the students towards research, clinical care, biology, etc. The number of students admitted is set by government regulation. The second cycle is 4 years. The first year is devoted to general medicine training. The 3 following years are dedicated to pathology and therapeutics, and the courses are given in the medicine schools and hospitals. Now on to the third cycle. Students reach the third cycle only after being certified, and then have a choice between 2 options, general medicine or specialized medicine. General medicine is a 2-year program of theoretical and practical training, rotations in hospitals, and a training course with a general practitioner. At the conclusion of the training, the student receives a state diploma of a general medicine doctor. Specialized medicine is a 4 to 5-year program which leads to a competitive exam in fields such as medicine specialties, surgery specialties, anesthesia, industrial medicine, public health, biology, and psychiatry. This specialized studies program finishes with a state diploma of medicine doctor, or DES. DES holders can improve aspects of their specialty by taking complementary specialized studies programs. Funding and insurance in France. The French spend much more on healthcare than most other European countries, and they worry incessantly about the cost of care. They are big consumers of medicine and they get a high-quality product, yet France pays much less than we do for healthcare. France has something called the National Health Service, which offers universal care to everyone. In the waiting rooms of doctors' offices in France, there are charts showing precisely how much the physician will charge for each service they offer and how much the National Health Service will reimburse for each treatment. Unlike the US, French insurance funds can't turn a person down for coverage regardless of pre-existing conditions such as heart disease. They also can't deny a claim, and they aren't allowed to terminate a person's coverage if they lose or change jobs. There are also no such things as networks in France. Any person can go to any doctor. Some people don't even have to pay in full at the time of their treatment, and people living below the poverty line and receiving welfare payments are billed just $7.80 for a doctor's visit. To show you just how affordable healthcare in France is, we have provided a video.
The French model, from David Turacamo, our man in Paris.
This summer in Paris, my friends Matt and Nomi had twins.
Pretty cool, huh?
Yeah, Matt's British, so they ended up naming their sons George and Alistair. But Nomi's French, and that's what's important here, because the entire family is covered by the French national healthcare system. So even though the boys were delivered by cesarean section and Nomi spent 9 days in a private room, leaving the hospital they paid
19 euros for the TV.
That's around $25.
I know what you're thinking.
Well, they also paid $165 for the first night. But you know, twins delivered by cesarean, 9 days in a private room, and the cost was about $190.
An important part of the healthcare system in France is their Vital Card. A Vital Card includes past doctor's visits, referrals, diagnostic tests, prescriptions, plus many other things. It also shows how much each doctor has billed from previous visits. And this is just a picture to demonstrate what their Vital Card looks like. The French follow the Mediterranean diet. This diet consists of high-fat cheeses, dairy, breads, fresh vegetables, and a small portion of either fish or chicken. In France, they do not eat as much junk food, so they tend to have lower obesity rates than us in America. France is the #1 healthcare system in the world, but like us Americans, they tend to spend a lot of money on their healthcare system. Along with high-costing healthcare, there are a lack of pediatricians, which result in longer waiting times.
Here's a list of sources we used. Thanks for watching.